Hey everyone, this is Aaron and I'll be going over clinical presentation and post-operative restrictions of a total knee arthroplasty, commonly known as a total knee replacement. I'll also discuss functional limitations to an activity that a patient with a total knee would have and suggest an alternative technique for that activity. First off, the total knee post-op would present in the PT clinic as a very swollen and red joint with sutures down the center of the anterior side of the knee, from just superior to the distal end of the femur to just inferior to the proximal end of the tibia. The patient will likely be using an assisted walking device like crutches or a walker to prevent falls and help regain strength and functional mobility of the muscles around the knee. The knee will be very stiff and painful to the patient, so it's critical in the early post-op time frame that the patient works on active range of motion exercises and stretches in order to prevent the knee from staying locked with limited flexion and extension. Now it's time for some post-op restrictions. These are generally not to overdo any weight-bearing activity. Avoid putting a pillow under the operative knee, since this will not allow the knee to reach its full range of motion in extension. Not to use heat, as this will encourage more swelling and inflammation. Not to pivot or twist on the operative knee, and keeping the operative knee in front of the other knee while sitting down or standing up, as this can lead to excessive force and range of motion that the knee simply isn't ready for yet. The additional doctor's orders should be followed when given.
Activity that will be limited due to a total knee replacement is getting in and out of a sweet ride like Lola here. Here we go, I'll just climb on in. And we're here. As you can see, many people without knee replacements, such as myself, have no problem getting in a Jeep. However, someone with a total knee replacement would be very limited in their abilities to enter their car. The specific restrictions that would be violated when I get in is my knee is flexing and weight bearing excessively, as well as twisting. If one was to attempt to get into a Jeep post-operation, I would recommend they first have someone slide the seat as far back as it will go to allow optimal room for them to get in. Next, back in. In order to turn around, don't pivot or twist the knee, but rather take small steps to turn around. Then use the arms and the non-operative leg to back into the seat and face forward. This eliminates the need to use the operative knee. Here's a demonstration with my right knee as the operative knee. First, have someone slide the seat all the way back. Second, the patient can proceed to get in.